Is fluoride safe? Is it necessary? Should we take it out of our water supply? I'm Dr. Mona Amin, a board-certified pediatrician and mom, and today we're discussing fluoride, what it is, why it's important, and some common myths surrounding it. Let's get to it. Fluoride is a natural mineral found in water, soil, and some foods, widely recognized for its dental health benefits. It's added to toothpaste and public water supplies to help prevent cavities by strengthening enamel, the protective outer layer of teeth. Fluoride works by making enamel more resistant to acids produced by bacteria, which can cause decay. It also supports remineralization, where minerals are restored to weakened enamel, helping repair early signs of tooth decay. Using fluoride toothpaste or drinking fluoridated water gives your child's teeth an extra layer of defense against cavities, especially ones that are forming. Fluoride is essential for dental health, especially for children, offering powerful protection against cavities, one of the most common chronic issues kids face. It makes teeth more resilient to decay, especially during childhood when teeth are still developing. The data shows that fluoride has made a significant impact. Studies have shown that community water fluoridation can reduce tooth decay by about 25% in children and adults. In areas where drinking water is fluoridated, kids experience fewer cavities, saving parents money on dental bills and reducing the risks of more invasive dental treatments. Similarly, fluoride in toothpaste has been shown to reduce cavities by up to 24% in children, according to the American Dental Association. When children brush with fluoride toothpaste, they're actively working to protect their teeth from decay and strengthen enamel with every brush that they do. Fluoride is found in several everyday sources, making it accessible for most people as part of their regular dental care routine. The primary sources include fluoridated drinking water, fluoridated toothpaste, fluoride supplements that can be in the form of liquids or tablets, mouth rinses, certain foods and beverages can contain fluoride, as well as fluoride varnish, which is a coating placed on teeth by pediatricians and dentists. Fluoride has been debated for years, with some raising concerns about its safety and necessity. The skepticism about fluoride often stems from a mix of misinformation, fear of chemicals, and distrust in public health initiatives. While questioning safety is always important, it's crucial to differentiate between valid concerns and misconceptions. Let's discuss the most common arguments and separate fact from fiction from needing a little bit more nuance. Some view fluoride as a dangerous industrial byproduct. While it's true that fluoride is a chemical, so are water, oxygen, and salt. The fluoride used in water supplies is carefully regulated, and its concentration is adjusted to safe levels, about 0.7 milligrams per liter, which is 1,000 milligrams in the United States. At this level, it strengthens teeth without posing significant risks. The dose makes the poison, and fluoride in appropriate amounts is both safe and effective. Concerns about fluoride affecting IQ largely stem from studies conducted in areas with extremely high fluoride levels above 2.0 milligrams per liter, far higher than what's used in public water supplies in the United States. The National Toxicology Program found insufficient evidence to conclude that fluoride at levels used in the United States affects cognitive development. However, ongoing research emphasizes the importance of using fluoride responsibly, especially in children. Yes, higher doses can be toxic, but this is 5 to 10 grams in adults and 500 milligrams in kids. So this is a situation of dose becoming the issue, and in amounts we ingest, it can be beneficial. Fluoride toothpaste is effective, but not everyone has consistent access to it or uses it properly. This requires better education programs, largely in underserved communities. Fluoridation programs provide an additional layer of protection, particularly for these communities where dental care may be limited. As I already mentioned, studies show a 25% reduction in cavities in communities with fluoridated water, proving its effectiveness even alongside toothpaste. This claim overlooks fluoride's role in preventing decay before it starts. Cavities don't just happen to people with poor oral hygiene, they can affect anyone and can also be passed from family members or be genetic. Fluoride strengthens enamel against acid attacks, making it beneficial for all ages and oral health statuses. And it also helps with remineralization and preventing cavities as they're forming. The U.S. has widespread water fluoridation to prevent tooth decay, particularly for low-income populations with limited access to dental care. Fluoride in drinking water serves as an affordable preventative measure for children in these communities who may not visit the dentist regularly or have dental education. In contrast, many other developed countries, such as those in Europe, may not fluoridate their water. However, these countries often provide universal or subsidized dental care, reducing the need for water fluoridation. Also, amongst developed countries, the United States consistently has the highest poverty rate. According to data from the Organization for Economic Cooperation and Development and the U.S. Census Bureau, the poverty rate in the United States is higher than in most other advanced economies. In 2020, the U.S. poverty rate was estimated at around 11 to 12%. And as I mentioned, those in poverty or lower socioeconomic statuses don't have the education to make proper dental hygiene choices, so rely on public health programs like fluoridation to help them. While some nations focus on education and direct dental care, the U.S. prioritizes water fluoridation as an essential tool to address oral health disparities, especially in impoverished areas. If we can educate more people and raise people out of poverty, then maybe widespread fluoridation programs wouldn't be needed. But as it stands, benefits outweigh any risks. Critics argue that fluoridating public water removes individual choice, likening it to mass medication without consent. This is a valid ethical consideration. However, public health measures often balance individual choice with societal benefits like fortifying foods with vitamins or iodizing salt. Fluoridated water benefits the community by reducing dental decay, especially for those without other access to dental care, and most public health programs lean in on helping the greater good. Some worry about fluoride entering local ecosystems and affecting wildlife. While research on long-term environmental effects is still evolving, studies show that minimal impact exists when fluoride levels are regulated. Continued monitoring ensures that these concerns are addressed responsibly. Fluoride is safe and effective for cavity prevention when used at the recommended levels. However, it is important to follow guidelines tailored to your child's age to avoid overuse. For children under 3, the American Dental Association and the American Academy of Pediatrics recommend a smear of fluoride toothpaste about the size of a grain of rice. For children 3 years and up who are able to spit out toothpaste, use a pea-sized amount of fluoride toothpaste. For kids above 6, use a normal strip as we would. As I have mentioned, if your community water supply contains fluoride, it's still recommended to use fluoride toothpaste. The fluoride level in drinking water is typically set around 0.7 milligrams per liter, which is considered safe and effective. This level was chosen to maximize benefits while minimizing the risk of fluorosis, which we will discuss. For parents who prefer fluoride-free products, alternatives like toothpaste with hydroxyapatite or xylitol can help. Speaking to a dentist can help too if you want a fluoride-free option. Too much fluoride during early childhood can lead to fluorosis, which affects the appearance of tooth enamel. Mild fluorosis shows as faint white spots that don't impact tooth strength, while more severe cases can cause brown stains or pitting from excessive fluoride intake. Mild fluorosis is the most common and often unnoticed, but moderate to severe cases typically result from high levels of fluoride exposure. Young children often have a habit of swallowing toothpaste rather than spitting it out, which can lead to excess fluoride intake. For this reason, it's important to use only the recommended smear or pea-sized amount of fluoride toothpaste for children and to supervise them closely during brushing. The risk of fluorosis decreases significantly once adult or permanent teeth begin to emerge, typically around the age of 8. Fluorosis only affects developing teeth that are still forming beneath the gums, so once the permanent teeth are fully in, the risk of developing fluorosis is essentially over. However, continued appropriate use of fluoride products remains important for cavity prevention in older children and adults. Generally, you don't need to worry if you follow age-appropriate fluoride guidelines. Using a small amount of fluoride toothpaste and supervising brushing can prevent both cavities and the risk of too much fluoride exposure. Fluoride levels vary by region, so it can be helpful for you to check your local water supply. Many municipal water suppliers publish their fluoride levels online, and parents can also use the CDC's My Water's Fluoride tool to find community fluoridation data. For households with private wells, it's recommended to test fluoride levels periodically as natural levels vary and may impact overall fluoride intake. Make sure your kids get the right amount of fluoride. Children can begin using fluoride toothpaste as soon as their first tooth appears. Teaching kids to spit out excess toothpaste helps limit ingestion and minimizes the risk of fluorosis. Practicing this habit early can help them develop good oral hygiene and reduce unnecessary fluoride intake. Many pediatricians and dentists offer fluoride varnish applications for young children. This highly concentrated fluoride treatment, recommended 2 to 4 times a year, adheres to teeth and provides extended protection against cavities. The AAP suggests starting fluoride varnish applications when the first tooth appears. No, fluoridation in water is one part of creating healthy teeth. Whether your water is fluoridated or not, here are other ways to raise kids with healthy teeth. The ADA and AAP recommend scheduling a child's first dental visit 6 months after their first tooth erupts or at 1 year, whichever one comes first. This initial visit helps establish good oral habits early and allows the dentist to offer personalized guidance on fluoride and oral hygiene. Yes, it's possible to maintain good oral health without fluoride, but it requires extra effort. Ensure your child brushes their teeth twice a day and flosses daily, especially once they have 2 teeth that touch. Ideally, your child should use fluoride toothpaste. It's an easy and effective way to strengthen tooth enamel and prevent cavities. For children under 3, use a tiny smear, and for children 3 and older, a pea-sized amount. Proper brushing techniques and using a soft bristle toothbrush are key. Minimizing sugary snacks with added sugars and drinks as well, and encouraging a balanced diet will also help. Limiting sticky candy and moving away from bottles in toddler years can also help. Starchy foods like chips, pretzels, crackers, or white bread, or acidic foods like citrus foods can also impact oral health. The key is moderation. Constant snacking or sipping sugary or acidic beverages increases cavity risk. If your child is under 6 and your water lacks fluoride, consult a pediatrician or dentist about how to proceed, as decisions can be made based on family history of dental health, diet, and hygiene habits. Sometimes fluoride supplements in drops or tablets can be recommended to help prevent cavities or using fluoridated bottled water. If your water is not fluoridated and you do not want to use fluoride toothpaste, it's important to still visit a dentist regularly to assess for cavities, brush teeth, and floss as recommended, and continue a balanced diet of less added sugar, citrus, and starchy foods. The lack of fluoride is not a definitive "you will get cavities" situation, but the underlying message here is more that the presence of fluoride and how we use it, whether in fluoridation in water or in toothpaste, in the amounts recommended, can add benefit for the general population, and so we shouldn't fear it if it is there. Fluoride is useful and should not be vilified when used in safe amounts. Kids' teeth are developing, and fluoride helps strengthen enamel before it becomes more vulnerable to decay. For children under 6, fluoride toothpaste or fluoride treatments from a dentist can be essential for protecting their developing teeth. In short, while it's possible to have healthy teeth without fluoride, it can be more challenging and requires diligent care and regular dental visits, especially in situations of poor dental hygiene, a diet rich of starches, citrus, and sweets, and also a family history of cavities. By understanding the facts about fluoride, you're empowered to make informed decisions that protect your child's bright, healthy smile, whether it includes fluoride or not. But we need to stop the spread of misinformation. What surprised you most about fluoride? If you found this information helpful, please give it a thumbs up sign, share it because that's how this show can continue to grow, and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. Comment below with any questions, comments, or personal experiences with fluoride. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.